This is a presentation for benefits open enrollment for 2019. For those employees who were unable to attend a presentation, this should be able to help you for open enrollment. So as a reminder, open enrollment elections can be made starting on August the 6th and must be completed by August the 20th. The biggest thing to remember is if you're not making any changes, you don't need to do anything, and your current benefit elections will continue. There's always one exception, and that's the flex spending plan. You must re-enroll in the flex spending plan every single year, and I'll talk more about flex spending towards the end. And as a reminder as well, Andy from AFLAC will be in the Courtyard Conference Room on August the 15th, 16th, and 17th. So if you're making any changes to an AFLAC plan, you need to meet with Andy. Here are a few more reminders. And if you are making changes, please look at the deductions on your first paycheck in October. And Brooke, Alana, and I are available in HR to help you with any benefits questions throughout the process. So as I mentioned in the beginning, changes to our insurance elections are done online. They're done online using employee self-services. This is what it looks like, and there's also a tutorial available on the HR Benefits Open Enrollment page if you haven't used this process in the past. So good news, there are no changes to any of our carriers. So there is only one change this year, and that is a slight increase to the vision premiums, which I'll talk about a little bit later. More good news is there are no changes to the monthly premiums we pay for medical coverage. Our medical insurance, and I'm going to go over that a little bit in detail, is offered through Florida Blue, and we have the option of 3 different plans to choose from. So here's a comparison of 2 of the plans. This is a comparison of the HMO plan and the PPO plan. In the HMO plan, you have to choose a primary care physician, and you do need to stay in the network. And the network includes the entire state of Florida. Now, if you are out of state and have an emergency, you do have coverage under the HMO plan, and that is for true emergencies. You can go to any specialist you want to in the HMO plan without a referral, except for an ophthalmologist. So if you are having an eye problem, you do need to get a referral to an ophthalmologist specialist through the HMO plan. Now in the PPO plan, you can go in network and you can go out of network. You don't need a referral in the PPO plan either. You do want to stay in network because if you go out of network, the physicians do not have a contract with Florida Blue, and they can charge you whatever they want for the service, and you could be balance billed for that. So they can charge you anything above reasonable and customary, and you will receive a bill for that amount that is over. I'm going to take a few minutes to talk about the third plan that the city offers through Florida Blue, and that's the high deductible health plan. So the high deductible health plan is similar to the PPO plan, and it's access to the same physicians, and you can go in and out of network. You have an annual deductible for in-network of $2,000 for employee and $4,000 for family, and you have a separate out-of-network deductible of $4,000 for employee and $8,000 for family. So you see why it's important to stay in network. Your preventative care, which is the last line here on the chart, is covered at 100%. That would be services such as like a mammogram, a well woman visit, routine colonoscopies, and prostate exams. So when you stay in network, you pay the contracted rate for services. So it's not a $15 copay for a doctor's visit like it is in the PPO plan. It's actually the contracted rate, and you do pay the full cost of the prescription. Once you've met that calendar year deductible, you have no other expenses for the remainder of the year. One thing you may not be aware of is you can go on Florida Blue's website and actually find the cost of services, whether it's a prescription or if you're having surgery, you can find out the exact cost. And not every pharmacy charges the same for prescriptions. So if you're considering this plan, you do want to use that lookup. I've been told that the high deductible health plan is good for 2 types of individuals, either the very healthy family member who hardly ever uses the insurance, or maybe the person or family who has more medical expenses and they may meet that deductible early in that plan year. And then, as I mentioned, they have no other expenses once that deductible is met. Florida Blue also offers member tools and programs. Their website is very useful. You can have a mobile application. You may actually need to use the nurse hotline. It's available 24/7. Let's say you're taking a new medicine and you have an allergic reaction. You can actually talk to a nurse about that. Now, as far as the health savings account, which goes with that high deductible health plan, it's designed to help you save and pay for your health care now and when you retire. The health savings account and high deductible is the only plan that offers you 3 separate tax benefits. All of your qualified medical expenses, which is your medical, your dental, your vision, your hearing, and your prescription expenses, can be saved and paid for on a pre-tax basis. So in addition to the tax benefits, another reason to save pre-tax is due to the high cost of health care coverage in retirement. The average 65-year-old couple retiring this year can expect to have $275,000 in medical expenses during retirement, and this does not include the cost of long-term care insurance. So I want to compare the PPO plan to the high deductible health plan as far as the premiums. So you see for family coverage in the PPO plan, you pay $220 a month. In the high deductible health plan, you pay $60. That's because you have a higher deductible, you pay a lower premium. So that is a $160 a month difference that you're paying to be in the PPO plan versus the high deductible, which is $1,920 annually, which you can put that money into your health savings account to pay for those expenses on a pre-tax basis. So I want to show you how you can get really close to meeting that $4,000 deductible. So in the family coverage column, you'll see your deductible is $4,000. Your premium savings, as I just showed you, was $1,920. Well, you may not be aware that the city does contribute money into your health savings account as well to help you meet that deductible. For family coverage, the city contributes $115.33 the first paycheck of every month, which annually is $1,383. So if you took that amount the city puts into your health savings account, plus your premium savings of $1,920, your remaining deductible is $697 of that $4,000 deductible. Another thing to remember is you can use the health center as well. Here, the Employee Health Center, and you have no cost for prescriptions or visits there. If you're a single person, the city contributes $59.58 into your health savings account to meet that $2,000 deductible. So you can actually put more money into your health savings account. And for 2019, the limit for family coverage is up to $7,000. So you can put that in a lump sum, or you can put that throughout your paychecks throughout the year and save more money for that health savings account. So in addition to the advantages you see here, at age 65, you can use the money in your health savings account for any expense without paying a penalty. The money can be used to pay for your Medicare Part B, Part D, and your Medicare Advantage premiums. You can pay for long-term care insurance. And retirement is considered a qualifying event, so you can switch from the high deductible health plan when you retire to the PPO plan or the HMO plan, where you know what your co-pays are going to be. You don't have to meet that higher deductible anymore. So here are some disadvantages as well that you should be aware of. In addition, it may be difficult to come up with the money to meet the deductible if something happens in the first or second month of the plan year. And illnesses are unpredictable, and they're hard to budget for healthcare expenses, but do know that your money rolls over year after year, and it's always yours in a health savings account. Here's just some additional information, and please feel free to reach out to me if you have any additional questions on the high deductible health plan. It really is a good way to save for retirement costs for your medical care. Now I want to talk to you about the flex spending account. So if you're not participating in the health savings account, you may want to consider participating in the medical flex spending account, which is administered by WageWorks. It's really easy to use. It works by using pre-tax dollars. So money comes out of your paycheck on a pre-tax basis, and then you use that money to pay for your medical expenses incurred during the fiscal year. You can use pre-tax money as well to pay for your daycare with a dependent care savings account. So before you enroll, you're going to want to estimate your health care or your dependent care expenses for the upcoming year. So that way you can decide how much money you're going to set aside. How much you save in taxes depends on how much you spend on your health care and your dependent care expenses each year and on your tax situation. Most people can save from $20 to $30 in taxes for every $100 set aside through their flex spending account. So if you pay for your children to go to daycare so that you can work, you're going to want to choose a dependent care account, which is going to pay for most forms of either before and after school care, daycare, your preschool programs, nanny services, your summer day camps, plus there's also an elder care service if you're for qualifying older adults. Now let's talk about the dental plan. The city's dental insurance is provided through Emeritus at no cost for employees or for family coverage. There is a detailed dental benefits summary on the HR benefits page. So the dental plan is a PPO plan. You can see that because you can go in and out of network. So you're going to, again, want to stay in network so you're not balance billed. There is a $50 deductible, and that's for type 2 and 3 services. So your preventative are your cleanings. Your cleanings are paid at 100%. And make sure that your cleanings are at least 6 months apart. They can't be 5 months and 28 days or it won't be paid. So they do have to be 6 months apart, and you have a $1,500 plan year maximum for dental. There is also a dental cost estimator, so if you learn that you need to have an expensive dental procedure, you can always ask your dentist to provide an estimate. There's an online service where you can find the average cost per procedure in your area. To do this, you just go onto Emeritus's website and choose the dental cost estimator link. You also have coverage for dental emergencies when you're outside of the country. AXA assistance is available in more than 30 countries with calls being answered 24 hours a day. You're going to receive a referral to a provider, and then you'll receive a follow-up call within 48 hours after your appointment. And once you get back in the U.S., you're going to want to submit a claim form to Emeritus for consideration. Okay, our vision plan is provided through the Superior Vision. As I mentioned earlier, our monthly premiums are increasing. You see the rates here. They went up very slightly, and these rates are guaranteed through September of 2022. Once you enroll in the plan, you're going to receive a ID card and a benefits summary. All of your co-pays, the frequency of how often you can use your benefits, and the allowance information is going to be listed here. The vision plan comes with some great discounts, such as 20% off of allowances on overages for lenses and add-ons like scratch coating or UV protection, and 10% off of disposable contacts. You also get discounts on extra pair of glasses or contacts, and you get discounts on LASIK vision. So the city offers basic life insurance and long-term disability through the standard. And the city provides employees with a basic life insurance amount at no cost, and that amount is 2 times your annual salary up to $100,000 with a matching accidental death and dismemberment benefit. So the basic life insurance also offers or provides a $5,000 benefit on your spouse and your children, in which you would be the beneficiary of that. And for our officers and firefighters, there is a line of duty benefit up to an additional $50,000. And I always like to remind everybody to update your beneficiary information as life changes. You're going to want to make sure that HR has the correct information, so you can fill out this form anytime during the year. You can also apply for additional life insurance by completing a medical history questionnaire. The voluntary life insurance cannot exceed 5 times your salary with a maximum of $300,000. You can also elect additional life insurance on your spouse and children as long as you have elected it, and the maximum for your spouse is 50% of what you elect. The cost is age-based, so every 5 years the rate will go up as we age, and the summary of benefits, again, is on the HR page, benefits page. There's also a long-term disability benefit provided to all general and SEIU employees. It's at no cost. It pays you 60% of your monthly earnings, up to $5,000 a month, and long-term disability would start when short-term disability stops, and short-term disability is a city-provided benefit, self-insured through the city, and so it's not through the standard, where long-term disability is through the standard. Again, for our officers and firefighters, you can purchase voluntary long-term disability insurance. It's 60% of your monthly earnings, up to $1,500. Again, there's a 180-day or a 6-month waiting period, and you do have to apply for it by completing that medical history form. Also, you may not be aware that the standard does offer free travel assistance to you and your spouse and your children through age 25. You're automatically enrolled and you're automatically covered in this. So you receive medical assistance should you need it for any emergency medical travel when you're more than 100 miles from home. Also, if you lose your wallet or passport, they are there to help you. We also offer supplemental insurance through AFLAC. There are 3 different policies offered. There's an accident, 2 cancer policies, and 2 hospital policies. The city's rep is Andy Cristiano. You're going to want to meet with him. As I mentioned, he'll be here at the city on August the 15th, 16th, and 17th to answer any questions, whether you are enrolling or if you're canceling a policy, you do need to meet with Andy. Another great benefit that the city offers all of our employees at no cost is an employee assistance planner program. You get 6 free visits per issue per person every single year. So whether it's for marital or you're stressed or there's financial issues that you're dealing with, EAP is a great resource. It's also for grief and loss, anger and substance abuse. You can find local services. You just give them a call, let them know what's going on, and they will hook you up with a mental health counselor who will help you with your situation that you're dealing with at that point. Other than open enrollment, the only other time you can make changes is when you experience a qualifying event. This allows you to add or remove a dependent to your current plans as long as you make Human Resources aware of that change within 30 days of the event. So a qualifying event doesn't allow you to change plans, such as going from a HMO to a PPO, or to add a plan or to remove a plan. It just allows you to add that dependent, whether it's a child due to a birth or marriage and you're adding your spouse. So any other changes are done during open enrollment. And here is a checklist. Again, open enrollment, the dates will be Monday, August the 6th through August the 20th. Everything is done through employee self-services, and they have to be done, any changes have to be done by August the 20th. Please don't forget to meet with Andy, and you have to re-enroll in a flex spending plan, whether it's medical or dependent care, and please don't forget to look at your paycheck on August the 5th. And if you have any questions throughout this process, just give me a call, stop by my office, and I'd be happy to help you. Thank you.